Hi, Dr. Pelto here. I had an interesting patient that came in recently, and they had this was if you just to situate you here. This is a picture of a big toe, and their big toe had a wound or a sore at the tip of it, and I took an X-ray, and this X-ray showed you see this like there's almost like pieces eaten out of this X-ray right here, and this is what it showed, and this patient didn't know what was going on. They didn't know why they had an issue. This patient had a history. He was a marathon runner. He liked to be active. He was actually still running at the time of this, and he had some issues with some cold toes. His toes always had calluses on the tip, and occasionally they developed little sores. And sometimes I didn't really think anything of it. I thought maybe he just had sores, and the sores kind of opened and closed. But this time I took an X-ray, and what I saw in the X-ray was something that kind of scared me a little bit, because this eaten away area is usually caused by a bone infection. He didn't look like he had a bone infection. He didn't have a lot of swelling. He didn't have a really bad what we call cellulitis or things going up the foot, but he did have a bone infection. And so the question is, can I take antibiotics to treat a bone infection? Now, if you're dealing with this, you should really see an infectious disease doctor or your doctor. But frankly, it's hard if you don't have the best circulation to get the antibiotic down to the tip of the toe. What we normally do is we remove that bad bone. So we'll like take out that bad portion of the bone and then take out some clear margins to make sure it's cleared up. You can sometimes try to do it with an oral medication or IV medication, IV antibiotics, but it's kind of a really hard things to do. So, and just so kind of a lesson here is if you have a wound or a blister or something on your foot that's not getting better, getting an X-ray is a good idea, because sometimes there can be an underlying bone infection that you're not really seeing and that you're not really aware about. So if you guys have any other questions, please let me know. You can post it underneath this video and I'll try to answer it as I can. Once again, I can't give medical advice, but I can certainly do other videos to help other people with it. Okay, thanks.